All right, good evening, everyone. Welcome to Code Chef's event on prevention of drug abuse called Breaking the Habitude. I'm your host, Achintya Gupta. This event is a CASA event, and CASA stands for Campaign Against Substance Abuse. So now, what are substances? So a substance in the concept of drugs is any chemical compound that has a specific effect on your body. Now, these substances that we'll be talking about are controlled substances. These are substances which have a high potential of abuse, due to which they are often regulated by the law. And abuse, as you may already know, refers to the use of substances in ways which are harmful to oneself or to the people around them. Now, here are some well-known substances. So we have alcoholic drinks such as cocktails, beer, wine, spirits, which include whiskey and vodka, and liquors, which are basically flavored spirits. Then there is tobacco, which can be found in cigarettes, cigars, pipes, and chewing tobacco. Then we have a group here which classifies as drugs. So in the drugs we have opioids, which are basically painkillers like morphine and codeine. Then we have cannabis, which can be found in marijuana, hash, and bhang is essentially an edible form of cannabis. Then we have sedatives, which are relaxants like valium, xanax, and rohypnol. Next we have stimulants. Stimulants include cocaine, meth, mdma, and adderall. Now, before we get into the causes and effects of drugs, I would like to get into some statistics. I would like to shed light on some statistics. So, the most accurate source for these numbers on a global scale is the World Drug Report, which is published every year by the UNODC. The UNODC stands for United Nations Office on Drugs and Crime. So here are some statistics. Here are some global statistics. So the main thing is in 2019, around 275 million people worldwide use drugs. Out of this, if we get into the specifics, we have 200 million people who use marijuana. 62 million people use synthetic drugs, also known as opioids. Then there are 27 million people who used amphetamines or other prescribed stimulants. And out of these stimulants, the most common was cocaine, which was used by 20 million people. um, Drug use increased by around 22% from since 2010 till 2019. So in about 10 years, drug use increased by 22% worldwide. And around 36 million people suffered from various drug disorders in 2019. Now, of course, a lot of drugs are injected through injections, and over 11 million people were injected with drugs in 2019, of whom 1.4 million people carried HIV and 5.6 million people carried hepatitis C. As you may already know, these are STDs which can either be transmitted through sexual contact or through injections. And this was, of course, the latter case. Now, people who inject themselves or use drugs are 29 times more likely to be infected by HIV than the general population. And global cocaine production almost doubled between 2014 and 19, which is around a 5-year period. Cocaine output reached a record 1,784 tons in 2019, and drug use is projected to rise by around 11% in 2030. Now, of course, these were just the global statistics. However, the situation doesn't get any better when it comes to India. So, there are around 3.1 crore cannabis users in India. For opioids, there are around 2.3 crore users, and for inhalants, there are around 77 lakh users. If we get more into the demographics, we have approximately 5% of all men in India who use cannabis, 0.6% of all women, and 0.9% of all children. One thing to note here, that children here refers to people under the age of 19 and above the age of 10. For opioids, we again have 5% of all men, 0.6% of all women, and 0.9% of all children. For inhalants, we have 1.34% of all men, 0.07% of all women, and 1.17% of all children. Now, after these grim statistics, you may be wondering, why does the problem actually exist? Well, these are some of the main contributing factors of drug abuse. Firstly, we have stress and emotional distress. If you have a lot of stress in your life, a lot of problems in your life, you might try to find radical ways of escaping those problems, even if it's just for a moment or a few hours. For this, people often turn to drugs, which can, of course, devolve into drug abuse. Past trauma also often leads to stress, which again leads to drug abuse. Now there are mental health disorders like depression and anxiety, which often leads people to drug abuse. We also have peer pressure. So this is one of the most major contributing factors. If people in your friend circle are drug users and ask you to try drugs as well, often people are unable to refuse them because they have a fear of missing out. They don't want to be excluded from their friend circle, right? So they end up trying drugs and end up getting addicted to it. Then we have easy access to drugs. Of course, statistically speaking, if you have easier access to drugs, if you can get drugs more easily, then you are more likely to try them. And lastly, we have family history. So people often look up to their families for inspiration on how to live their lives. And and this goes both ways. It can be good inspiration or it can be bad inspiration. And if there is a history of drug abuse within your family, then people are also more likely to try out drugs. Now, let's talk about the effects of drug abuse. These can be broadly categorized into three categories. We have physical health issues, mental health issues, and social issues. So, under physical health issues, we first have organ damage. So, as we know, drugs are foreign compounds. They are compounds that are often not known by our body. So, our body doesn't know how to react. It doesn't know how to process these compounds. So, it obviously ends up damaging a lot of the organs in the body. It can damage your respiratory tract, it can damage your digestive tract. Speaking of respiratory tract, we have respiratory problems. Extensive usage of drugs can lead to respiratory problems such as asthma. Then we have infections. So, as I already discussed, a lot of drugs are injected through syringes, and often when people are injecting these drugs together, they tend to share their syringes, and this leads to the spread of infections such as HIV and hepatitis. Lastly, we have cardiovascular problems. So drugs increase the risk of heart attacks and just increase the blood pressure of the body in general. Next, we have mental health issues. So, as previously discussed, anxiety and depression often lead to drug abuse. However, they are also a symptom of drug abuse. So, this leads into a vicious cycle where people with anxiety tend start using drugs, and then their anxiety and depression just increases. So, they use more drugs, and it just becomes that vicious cycle. Next, we have psychosis, which includes hallucinations. So, obviously, many people might know that drugs induce hallucinations. However, extensive use of drugs can lead to hallucinations even outside of when you're actively using drugs. Next, we have mood disorders. So, drugs can often lead to bipolar disorder, of which a major symptom is major mood swings. Lastly, we have insomnia, which is pretty self explanatory. People who use a lot of drugs have trouble sleeping. Lastly, we have social issues. So, firstly, social isolation. So, people who use drugs a lot are often ostracized and kicked out of large communities. People don't want to associate with drug addicts, which leads to social isolation. Under this, we can also put relationship problems. Drugs are responsible for breaking apart a lot of families and friend circles. Next, we have legal problems. So, as discussed earlier, the drugs that we're talking about are controlled substances. These are substances, that are under the preview of the law. So these substances are often illegal in most countries. So people have to go through legal loopholes and go on the black market to buy these substances. So obviously, if you are caught, you can be arrested and you can be incarcerated, which leads to a lot of legal problems. Next, we have financial problems. So, as these drugs are illegal in most countries, they are pretty expensive. You have to buy them off the black market, and on the black market, there are no price regulations, obviously. So, these drugs sell at extortionate amounts of money, which obviously leads to financial problems since people who are addicted try to buy these drugs as much as possible. And it also leads to work related problems. So it leads to increased absenteeism in work, decreased productivity in work, and it can even result in loss of employment results in loss of income, which again leads to financial problems. Next, so let's get on to Treatment of drug abuse. So, how can we treat drug abuse? Treatment basically includes supportive care as well as medication to address symptoms and prevent complications. So, there are many components of treating drug abuse. The first is assessing the individual's needs. So, of course, as you might know, every individual is different. What drugs they were addicted to might be different, and their physiological makeup might also be different. So, every individual first needs to be assessed, and it needs to be decided what treatment would be the best way to go for them. Then the second step is usually detoxification. So detoxification simply refers to the removal of toxic substances from your body. um, this of course could lead to withdrawal symptoms, which I will get to soon. Next, we have rehabilitation. So rehabilitation refers to the process of the treatment, and then it also includes many interventions such as counseling, and it also includes the next 2 points, which are medication assisted treatment and aftercare. So medication assisted treatment simply refers to the treatment of drug abuse using medications. So often people are unable to give up drugs completely by themselves, so they need certain medications to kind of calm their desires down. And it also helps in avoiding relapse. So relapse is basically when you leave drugs and then you go back to drugs. Lastly, we have aftercare. So even after a person is declared as free of drug abuse, there is still some aftercare needed to make sure that that said person doesn't fall back into drug abuse. Next, so let's get into more into rehabilitation. So, what exactly is rehabilitation? It is a process for treatment on or dependence of substances. So, the general intent is to enable the patient to confront substance abuse and stop substance misuse. Rehabilitation for drug abuse and addiction involves everything from the initial treatment to medications to the final aftercare counseling to make the person from a drug addict all the way into again a functioning member of society. Next, what are withdrawal symptoms? So, withdrawal symptoms are any physical or psychological symptoms which occur when a person who is heavily dependent on drugs suddenly stops using drugs or significantly reduces their use of drugs. Now, withdrawal symptoms can vary widely from person to person. It depends. It depends on what drugs they're using and depends for how long they were using them, and the severity can also vary from person to person. Withdrawal symptoms can range from mild to severe and can be extremely uncomfortable or even dangerous in some cases. Now, talking about some symptoms of withdrawal symptoms, we have physical, psychological, cognitive, and flu-like. So, physical symptoms includes tremors, sweating, nausea, vomiting, diarrhea, muscle aches, and fatigue. Psychological symptoms includes anxiety and depression, irritability, agitation, insomnia, and mood swings. Cognitive symptoms includes impaired memory, concentration, and judgment, and flu-like symptoms includes fever, chills, and body aches. Now, what are the overall steps of giving to give up drugs? So I have classified it into 4 steps here. The first and perhaps the most important step is to make up your mind. The person who wants to overcome addiction has to decide that then they have to prepare, and they have to find support to help them overcome the addiction. It's always good to find a doctor while overcoming drug addiction, because you never know what medical complications might arise during the withdrawal symptoms phase. Step 2 would be to start treatment. As I have discussed before, always make sure to consult your doctors while the treatment is ongoing. And these treatments, obviously, as discussed before, includes assessing the individual needs, detoxification, rehabilitation, medication assisted treatment, and aftercare. Next, we have manage the withdrawal symptoms. So the step 3 and 4 are kind of under step 2. So withdrawal symptoms occur, as discussed, when the person gives up the use of drugs, and they can be it can be really difficult to cope with withdrawal symptoms. As you might remember that I said that one of the major withdrawal symptoms is anxiety and depression, and I also said that anxiety and depression is a cause of drug abuse. So a person has to have the mental courage to overcome the anxiety and depression during the withdrawal symptoms phase so as to not get back into drug abuse. Now, the step four would be to avoid relapse. So, again, relapse is pretty common among people, and it can be even dangerous. Why can it be dangerous? Because relapse occurs after you have been treated for drug abuse, and because the person, because said person hasn't used drugs for a long while, there is a high risk of overdose and dying from the overdose while relapsing. So relapse is one of the most dangerous phases of drug abuse, of prevention of drug abuse. So this might lead. So these were some of the effects and treatments for drug abuse. But how can you help if someone in your family or your friend is suffering through drug abuse? How can you help? So I again have 5 points here. It's educate yourself, get support, get counseling, don't enable, and have realistic expectations. So educate yourself. Now, it's important to get information about addictions. Try to attend webinars such as this one. In fact, you have to understand the disease process of the addict. You have to find out what drugs the person was addicted to and find out how it impacts the person. You also have to find out how it impacts the family and friends of the person. And again, it's often said knowledge is power, and if you understand your loved one's problem, it will be easier for you to help them. Next, you have to get support. You have to try to get support for the loved one and even for yourself, because while they're going through this difficult phase in life, the support might include counseling and doctors. Next, we have get counseling. So it's often a misconception that only the person suffering from the disease needs to get counseling. It's good for you to get counseling as well, so that you can better assist the person who is suffering from the disease. The more counseling you get, the more informed you are, and the better you will be able to manage your loved one through their difficult time. Fourth, we have don't enable. So obviously it's always a difficult time when a loved one gets into drug abuse. So family members often have supported their loved ones drug abuse issues even without fully realizing what they were doing. You have to make sure to not rescue the addict. You have to let them experience the consequences of the disease. It might be difficult, but you have to let them suffer because it's for their good only. Lastly, we have realistic expectations. So often people have really high expectations of drug abuse treatment, but people have to understand that drug abuse treatment is really difficult, and it can fail, in fact, of many times. The main thing is to keep at it. If it fails the first time, do it the second time, do it the third time, but eventually it will work. But you have to have realistic expectations. You have to make sure not to lecture the addict. They are usually just going to ignore you if they don't like what you are saying. You have to make sure that you hold them accountable. Hold them accountable to expectations and offer help to them directly if during their treatment. And of course, if you don't expect addict to keep promises, because they're not able to think straight during the process of drug abuse and during the process of treatment of drug abuse. And of course, don't react with pity or anger. It won't help the addict. It will only worsen your relationship with the addict. Make sure to have realistic expectations. It will help you stay in the process of the treatment of the addict. Now, I think it's important to understand that drug abuse is difficult for everyone, right? People who have suffered from drug abuse, they have kept at it. People who have cured drug abuse have kept at it. So make sure to support your loved one during the drug abuse. Thank you.